Some of our news headlines. Dr. Fred Sweet from Rockford Spine Center joins us here now on the 23 Morning Blend. Good morning, Doctor.
Good morning, Andy.
As I mentioned beforehand, we booked this a couple, 3 weeks ago, and we're going to talk about those sledding injuries and shoveling injuries and snowboarding and skiing, and well, we don't have much of that to talk about. So what do you want to talk about?
No, whatever you want to talk about.
It is still going to be, we're going to get some snow, we're going to have some winter here. What are some of the most prevalent injuries doctors or physicians see on a daily basis?
Well, the common things are broken arms and legs are the most common after, sledding, snowmobiling. But those are not the ones that we really should be concerned about. You can recover from that. It's the head injuries that can really either kill you or change your life permanently in ways that you're not going to be real happy about. Mm-hmm. So those primarily are based on helmet wear, speed, and alcohol use. Most people, when they have an accident, don't think this is going to happen to me. Nobody intends to do that. And they think, as long as I don't do anything stupid. Well, doing something stupid is riding a snowmobile or sledding without a helmet. Even though it seems kind of unusual to wear a helmet and it's funny looking, it can actually save your life.
And are there specific helmets for snowmobilers? Or can you just use the old bike helmet you got, stored in?
Well, that's a good question. If you ask the snowmobilers, there's, I'm sure, a great variety of sport-specific equipment, even for snowmobilers, are much more similar to the motorcycle helmets that are well reinforced. And there's one specifically for bicycles and even sledding.
Do you use those? I mean, you mentioned sledding here. I mean, kids going to go down, the hills here all over the place in the area. Should kids wear helmets when sledding?
Absolutely. That's if you think about it, on a sled you can get up to 15, 20, even 30 miles an hour. And if your head hits a tree or a rock, even a hard patch of ice, it can be lethal or produce a significant injury you just can't recover from.
Is that where the bike helmet can be applied there?
Again, a bike helmet may not be sufficient, and you can check with the sporting stores that sell that equipment, and they have professionals that can give you advice on the appropriate helmet wear for the particular activity you're going to do.
Well, you of course, at Rockford Spine Center, I'm sure you deal with lots of shoveling and related injuries. What are some of the, if we get some snow to shovel here later on this winter, what are some tips for people who will embark on trying to clear that driveway?
Well, first of all, if you're not in very good condition, don't go out and shovel the whole driveway. Get your spouse to do it.
Yeah, yeah, there you go.
Snowblowers are always a really good investment to protect your back. If you do have to shovel, use a small shovel and lift small amounts of snow.
Oh, see, my thing is I get a big shovel, I get it done sooner, and
nice.
I'm not out there.
I'll be seeing you soon.
Okay. Take it piece by piece, then, is what you're recommending.
Yeah, that's exactly right.
Okay, all right. And what other ways to, ice skating? What are there concerns with ice skating, too?
Well, any sport where you're traveling at a high speed and could fall and hit your head or at a high speed, you can have a significant head injury besides all the usual twist your ankle, break your arm kind of thing. And it really becomes a risk-benefit ratio between what the risk of the activity is and how silly you might feel wearing a helmet or other protective equipment. Gloves, clothing, boots, keeping warm, those are all important. The helmet is important. And the other thing we don't often think about is alcohol. Alcohol impairs our judgment as well as our ability to respond in situations. And then the last thing is we tend to put our kids on high-speed vehicles like the snowmobiles, and they're really akin to a car or a motorcycle. If they're only 13 or 14 years old, it may not be the wisest situation.
Let's talk about something that's certainly been making the headlines more so than our lack of winter here, the flu bug. I'm sure you as a doctor are seeing all kinds of patients or had to change or cancel appointments because of the flu. It's considered an outbreak now. What do you got? You got any tips so we can dodge that if possible, if we haven't already done so?
Sure. Most of the media is reporting on if you get sick, don't go to work. Well, the better strategy is avoiding getting the flu to begin with. And those believe it or not, the most important thing you can do is wash your hands very carefully before you put them in your mouth up near your face.
Just before eating dinner, then?
Before eating dinner, that's something that we don't always think about.
Usually it's after dinner we think about maybe washing our hands or something.
No, do it beforehand. Most of the time, the flu and other illnesses are spread by contamination on our hands, countertops, doorknobs, and then we put our hands in our mouth to eat a piece of candy or do some other hygiene operation that then contaminates it. The other one is aerosols. When somebody sneezes, obviously, and there are aerosols with viruses that we then inhale. So staying away from people that are sick is also helpful, but washing your hands is probably the most important.
And a flu shot, of course, and it won't take effect immediately, but if you don't have one yet, you can still get one.
Yeah, the problem with the flu shot is they have to guess and anticipate what the particular type of flu is each year.
Yeah, that's true.
And this year there are 2 different varieties of influenza that the CDC has reported. So the flu shot may not cover all the particular flu viruses that are floating around.
You got some personal, I mean, being a doctor, have you seen a huge increase?
Yeah, I have. I have 7 children in our household, and we vaccinated all of them. 2 of them subsequently got influenza that was not covered by the vaccine. So, and some of the symptoms you can look for that are different than a normal cold is if you have a fever and muscle aches are the 2 things that tend to help steer you towards thinking that you might have more than just a cold.
What about keeping hydrated when you're ill? Because sometimes it's just hard, but that is important, isn't it?
Yeah, it is. What's difficult is if you have a child, especially if they're not feeling well and nauseated or throwing up, and trying to force liquid down them may not be the best thing. If it's really getting critical, that's when you should visit your pediatrician. But if we're normally just have a head cold or the flu, keeping up with the fluids is really important.
All right, Dr. Fred Sweet from Rockford Spine Center. See, I got their website up there. They probably got, winter safety tips up there and more information about the Spine Center. They're on McFarland Road. So when we do have that shoveling to do, and you do have that kink in the back to work out and other ailments that need your attention, Rockford Spine Center can take care of things on McFarland Road. Thank you, Dr. Sweet.
All right, thank you, Andy.
We'll be right back.